Hello and welcome to Revive Health's daily briefing live for Thursday, June 11th. This is our 30-minute review of the latest, most important news, resources, and advice for health systems, health system marketers. I'm Elizabeth Musson, your guest host for today, and I'm joined by Chase Kleckner, our Senior Marketing Manager at Revive Health and our show producer. Hey, Chase.
Elizabeth, as you can hear, it's a lively household.
That's the way we like it. And then today we're also joined by Don Stanziano, Chief Marketing Officer at Geisinger. Don oversees all of marketing and communication digital platforms for both the health system and for the health plan at Geisinger. He joined in January of 2018 after a long stint at Scripps in San Diego. He was there for 16 years, including 8 years as Vice President for Marketing and Communications. Hey, Don.
Hi, Elizabeth. Hi, Chase. Nice to be here with you.
Yeah, thanks for joining. Well, you all know the drill by now. We're covering the latest news on COVID-19 and how it relates to marketers and communicators and health systems, hoping to highlight some helpful resources, share what we're seeing, and then you'll be hearing a little bit about what's happening at Geisinger. And then we'll open the floor to questions. So as we go through the show, please make sure to use the question queue in Zoom at the bottom of the screen there. We'll get to as many of those questions as we can at the end of the show. If you want to chat with other attendees, you can also use that chat function. But if you want us to see questions, please do make sure to use the question queue. And then as we go through the show, Chase will be posting some of the relevant links that we're talking about. So do make sure to check out that chat function so that you can grab those and take a look at them. You can subscribe to our podcast on iTunes or wherever you get your podcast. Search for Revive Health Daily Briefing Live. We do post these recordings by the end of the day on our website, which is thinkrevivehealth.com/COVID-19. That's also where you can get all of our content and resources related to addressing the crisis. Before we jump in, a couple important notes that we always cover. So just remember, we are not experts on COVID-19. So this isn't where you're coming for medical or scientific information. But we do have lots of opinions on how marketers and communicators can think about the COVID crisis. A reminder that everybody's situation is different. Each health system is different. Each market is different. So please do make sure that the decisions that that we talk about today, that evaluate them for what's best for you and your organization. And with that, let's begin. So as you know, we always start with the latest count. Just important to keep tabs on how things are going, whether cases are growing, hopefully eventually receding, and to keep that information in mind and in context as we think about the discussion today. Our resource and where we get our information is from the Johns Hopkins dashboard. So as of this morning, the global case count was 414,050 cases. The global death count was 417,514. And here in the US, topping 2 million cases at 2,003,930. And the death count at 113,038. So we'll continue to look at those cases, especially as I'm sure everyone's been watching some of the small surges again post kind of Memorial Day and as places start to open up. Just want to take a minute, point out an article that came out recently that we think will be of interest to marketers. Ran in Becker's this morning from Kelly Gooch. She talked to a handful of folks across the industry in positions similar to where most of you all sit, so leading marketing and communications for health systems, just about how they're starting to adjust their messaging as the pandemic evolves. A lot of folks talked about how they're continuing to tell stories about people on the front lines, but that their messaging is starting to shift a little bit as we move into some reopening in some markets. So Don, I know we're going to get into this in great detail later of what's happening at Geisinger, but maybe just tell us a little bit about what where you all are in terms of marketing messaging and what you're pushing out to your communities right now.
Yeah. Obviously, like everyone, we were very focused, particularly in March, April, and May, in managing the crisis, managing the surge. Pennsylvania saw, because of our proximity, particularly here in Eastern Pennsylvania, our proximity to New York and New Jersey, we did see an increase in cases in April, and that continued through May. That has now started to drop. Thankfully, we have seen a pretty dramatic drop in our in-hospital COVID cases here in the Geisinger service area over the last couple of weeks. I said probably since Memorial Day. So the marketing function, the communications function, has pivoted, as the organization has pivoted, to reopening. Pennsylvania is a state where the governor has done a color-coded reopening tiering system, where we've gone, counties are either red, yellow, or green. And our area has been a mixed bag for several weeks, where you could cross a county line and you're in a red zone where everything's shut down, or a green zone where most are opening. So, and that's been a pretty dynamic process over the last couple of weeks. But what it's done for us is we've been unwinding all the things we wound up back in March and April. So reopening clinics, and that's had a whole new host of things. I mean, obviously, we've been focused on safety the whole time, but and you guys have been issuing information on this and on public perception, and one of the hurdles is safety. So we're trying to reinforce that message, but just supporting operations, supporting the clinical teams, and making sure that we're getting people back appropriately and accessing care appropriately.
Yeah, and so that kind of coordination, as we've talked about a lot, is so important to make sure you're in lockstep with the operations side of the house, so that we're not, driving people to a place that's not ready to see them. So I think, just also for listeners that are not familiar with Geisinger, I think you all have such an interesting market because it is more rural, but the services that you offer and the level of care is just really on par with much more urban areas where people would think about the access to the types of care. So it's been really interesting to follow how you were almost able to kind of put up a wall on the eastern side of your service area that seemed to really help keep the cases across the rest of the part of central Pennsylvania and your service areas down. So
yeah, it's been a variety for sure.
Yeah, well, we'll give some credit to the communications and marketing team, that making sure that people were paying attention to what was happening and how to stay safe. So well, I will plug one article for Geisinger that I hope everybody takes a minute to read, especially those that are not familiar with the system and the community. But a couple weeks ago in the Washington Post, Todd Frankel wrote an article, captured the big G in such an authentic way. He actually spent a couple days in Danville, driving around, meeting with different physicians, kind of experiencing what life is like there and what it's been like during COVID. So everybody should go read it, take a look. It just does such a great job of capturing kind of who you are and what makes it so special there.
Yeah, thanks, Elizabeth. That is absolutely true. And one of the reasons I know that's a true statement is because folks who have grown up here and lived and worked here forever said the same thing about it. Yeah. So unlike transplants like me who thought it was a great capturing of the place, it resonated with people who are from here and have called this place home their whole lives. So I would encourage folks to read it if you have any curiosity about Geisinger and the communities we serve. They did a great job.
Yeah, great. And then I know we have another one hot off the press today. You want to?
Yeah. HBR ran an authored piece by our CEO, Dr. Jaewon Ryu, and Dr. John Slotkin and Karen Murphy, who is our Chief Innovation Officer, and talked about some of the things that we have learned through COVID and some of the takeaways that are coming out of it, and particularly some of the things that are going to sustain us in the post-COVID world, like telemedicine, sort of here to stay, and was absolutely essential for patients to continue their care, as all of us have learned during the crisis. But now looking at ways to utilize that in a post-COVID or post-crisis, because we're still with COVID for a while, but post-crisis healthcare environment, and then contact tracing, which is critically important before and until we get a vaccine, understanding how the disease is spreading in communities. And we've been doing a lot of work in that space. And I think it speaks to what you said earlier about preventing spread in communities where maybe it hadn't been a hot spot, and we're keeping the hot spots out of places. So that's been really interesting.
Yeah, and I think speaks to the sort of infrastructure and the way Geisinger is set up and operates anyway, that you kind of already had a lot of that infrastructure to do that contact tracing, where so much of your work is so far upstream from where most health systems spend their time. It's the making sure that people have food and visiting people in their homes with Geisinger at home, and looking at those ways to get upstream to keep people healthy versus just that, treating people when they're sick. And so I think I would imagine a lot of that success is because you had those people and the infrastructure to kind of do the community outreach that's needed to keep people safe and aware of what's happening.
Yeah, that's exactly it. I mean, we have the infrastructure in place because of our care and coverage model, where we're, a payer and a provider, and there's an incentive for us, quite frankly, to be able to prevent illness. Obviously, we have tertiary and quaternary care at the big G, as you mentioned, and can take care of folks just as well as any metropolitan, academic medical center. But at the same time, our goal is to keep people out of the hospital if we can. So.
Yeah. Well, that is a good transition into really the meat of what we want to talk about today, which is just hearing a little bit from you about what's happening in your market, and then really focusing on how you've been able to use the Geisinger brand and the strength of the Geisinger brand during this time to keep people kind of informed of what's happening and ensure that operationally you are all able to continue the work. So we touched on it a little bit, but maybe just give us a quick update on, where you guys are in the market, how things are with COVID. Sounds like it's starting to decrease in most of your communities, but just a little more there would be great.
Yeah. So we were, I think fortunate. This was a time where I felt like we really were able to lean into our brand, and we had just rolled out a new brand platform. And as you said, we have a lot of infrastructure in place to prevent illness, to talk about wellness upstream, and that's where we were emphasizing that. And so when we pivoted and had to pivot quickly, as we shut down non-emergent procedures, closed down a lot of clinics, and had to get a prevention message out to around COVID-19, we were ready to do that as a department and really support the organization with the communications and the marketing materials that were needed to spin that up quickly.
Yeah, and so it sounds like things are starting to open up a little bit more right now, both kind of community-wide, and then are you resuming elective surgeries and things now?
Yeah, we're dialing everything back up. Most of our ORs are open, and we just got a couple more that are not yet to open. And we're slowly bringing back our outpatient clinics. We've had to ramp up, and this gets into another piece of work of the team, and our brand team did a great job of putting reopening kits together that we sent out to all of our clinics, our outpatient units, helping folks understand where to stand when they're coming in, to promote social distancing, a lot of masking information, information about why you can't sit in that chair because and then helping with internal communications and helping with the workflow, because everybody's job changed, and I don't think you can underestimate that either, for all the folks who work in those clinics and hospitals.
Yeah, it's a good point. I mean, brand is not just what happens in the market. It's also very much what happens within your own system. And I know you all did a lot of communicating internally. I think one of the things that Washington Post article talks about that we mentioned is just that how, in communities, and I think this is true across a lot of rural healthcare, is that, the people that are in the community are also the people that work at the hospital, and there is so much crossover. So maybe tell us a little bit about kind of how that plays into your brand, and how, your internal communications, how they have to be very reflective of what you're putting out externally, because it's getting to the same people in a lot of cases.
It actually is. And that's a truism everywhere. I mean, I think you all in communications know that if we send something out broadly inside the organization, there's a high potential for leaking. But it's a whole different dynamic here, because so many of the households have a Geisinger employee in them that that when you send an announcement out broadly inside the organization, I know for a fact that there are employees of the local newspaper who are married to people who work at the hospital. And so it's as good as sending out a press release.
Yeah.
So we have to really we have to be very thoughtful about our internal communications from that perspective. And is this something we're ready to talk about externally? Do we have our external messaging buttoned up in a way that we're ready to have that conversation with the community as well, and thinking through all the community impacts of an announcement? So that involves everything from employment to the services we offer.
Yeah.
So but the flip side of that is the word of mouth is really strong, and
Sure.
if people are feeling good about you and have good things to say about you, it gets around pretty quickly.
Yeah. Let's talk a little bit about so you mentioned that you all were rolling out a new brand kind of right as all of this was starting to happen. So maybe just tell them a little bit about what that brand is and how it's different from your previous brand, and why that kind of repositioning really allowed you to be able to leverage the strength of that new brand
Right.
and pivot into the crisis.
Yeah. Well, we had a brand promise that was about caring and really emphasizing the clinical experience.
Yeah.
And it was nice, and it was fine, and I think it met a need at the time that it was created, but it didn't serve us across the board, and was more about how we do what we do instead of why we do what we do, which is what I think the essence of a good brand is. Sort of, what's your reason for being in the universe? And so we went back and did some hard work back in 2019 and late 2019, and that wrapped up right around the holiday time, and where we started to launch it around our core essence. And you've already talked about this, that it's, we're not just about healthcare, we're about total health. And so our brand promise is better health for all, and essentially making that easier for everyone. And so you translate that in all the various ways you can translate that. And it really fit the moment. We had a brand television spot out in the market when COVID hit that was really trying to connect us to working to connect us to the community. And in a time when a lot of folks had to turn off their advertising, we didn't have to do that. Instead, we put a sort of a runner underneath that talked about our COVID hotline and our COVID web resource page to connect the brand message to the moment, without having to create a new TV spot, and without having to turn it off either.
That's huge, because a lot of people did just have to pull it all. So, and I think, it aligns with, I know if Chris was here instead of me hosting today, he would talk a lot about that, post health system brand that we talk about so much at Revive, and how you move away from, pictures of doctors in white coats with your awards and a laundry list of your services. And it is more about, meeting people where they are, and the value that you bring to their life, not just to healthcare. And so I do think that shift really helps. This has been a great example of how that shift, if hospitals can make that shift from the transactional nature of a brand to kind of thinking about it as the value proposition.
Exactly.
That as we weather these, like one of the questions that we saw that came through is about like how you adjust over the next 6 to 12 months when this is almost certainly coming back. So maybe a little, if you could just talk a little bit about where you are thinking about how the brand could evolve and how you'll adjust your efforts as things kind of spike and decrease and those pieces.
Right. Well, I think one of the things we've learned in the last 3 months is, and we actually had a study published recently that on stroke care, and how stroke care people were not accessing hospitals because who actually were experiencing mild strokes at home, and the risk of that. And so I think one of the things we've realized as a healthcare system in the country is we can't postpone needed care, even in times of a pandemic. So I think if we did get a second spike, we're going to have to hit that message a little harder, because there's a when we say elective, people don't know what that means. Clinically, what we mean is non-emergent, like really not urgent, non-life-threatening. But there are things that were postponed that were not life-threatening in March that became life-threatening in May because they've been delayed so long. So heart conditions and high blood pressure that gets you to a point where you're at high risk for a stroke. We need to, I think, as we move into a potential surge again, be really clear to our patients and our communities about what care they can still access. And we know more about COVID now than we did in March. So we know how to do surgery safely in a pandemic. We know how to provide preventive care safely in a pandemic. I think this is where telemedicine comes in again strong, if we have to dial back. But I don't think we would shut down to the degree we shut down the first time.
That message of like continuing some care and maybe not like really stopping as much as where I think that's definitely true from what we've seen across the country. Well, that, I think that kind of brings us to some of the lessons learned type things. So maybe just, if you could just tell us a few things that you think would be helpful to your peers, folks that are listening, around some of the things that you've been able to do, kind of capitalize on in the midst of COVID, that things that have changed for you that you think you'll continue, or things that were just really helpful for you during this time.
Yeah, no, that's a great question. So one of the things that became critically important is employee communications, and we increased the frequency and the intensity of our internal communications. We were doing once a day newsletters. We were doing twice a day during COVID. We're probably going to go back to one a day soon again.
Good.
Internal communications team is very busy. But it was just because of how dynamic the information was during that, especially during the crisis period. But what we saw was an increased interest in utilization in internal communication. So we're going to try to figure out a way to keep that traffic level up on our intranet and our push communications and email and so forth. The other one is we actually did some experimentation with multicultural marketing. We have some pockets not in rural central and northeastern Pennsylvania. We have predominantly Spanish-speaking communities that were not being spoken to during COVID by anybody. And we were seeing them showing up in the ED without a lot of information. So we spun up some information there. We've created a little bit of an infrastructure there. And I know, for a lot of communities, I came from Southern California, Spanish is sort of, that's just part of the marketing mix.
Sure.
But wherever you are, there are probably unmet communities with unmet needs that maybe COVID brought to light. So I think that was another takeaway. And then thirdly was this forum, because of social distancing and so many people were working from home, to utilize virtual meetings differently. Marketers, we do a lot of meetings.
Yes.
There's a lot of logistics involved. Actually, this is easier. And I think, people have gotten used to it. So how do we utilize this technology to promote our organizations, either from a paid or from an earned media perspective? We were doing weekly news briefings with the CEO for about 2 months during the height of it, and we use this format for that.
Yeah.
virtual press conferences.
And I think you guys used it for even like physician to physician communication, which was,
Yep.
as we like, information lag was a real problem for a lot of clinicians of just how quickly things were changing. So I think that was probably a good, a good way to get information quickly and give people that forum to talk through questions and conversations.
Yeah, we had a weekly, we're still doing them, weekly provider town halls. We have a weekly employee town hall, or every other week, I should say. And then we did specific virtual town halls for EMS providers. We did one just for the surgeons as we were bringing back surgeries post-COVID. What do you need to know? What are the new protocols? How are we going to schedule surgery? Staggering. So I think this is a tool now that is I think permanent for us.
Yeah, and I think it's easy we kind of get into the just send stuff out via email, let them read it that way. But I do think that they're, beyond just like the platform of just thinking how you can deliver information in different ways, whether it's live like this and kind of this sort of forum, or I saw so much of the information that you put out was really visual. So instead of just sending out stuff that was, here's your bulleted list, putting some icons to it and making it a bit more visual. I think a lot of those things across the country and for health systems in general are the types of things to be thinking about of like, how do we take these things that we did out of necessity, but that have actually proven to be really effective, and carry those through the like in what will normal times feels like a weird saying, because what will be normal, but how do you carry through those things that you stood up so quickly?
No, that's a great point. And I think this is where the brand came to life, is because we had iconography as part of our new brand, and we leveraged those icons to help make complicated information simple and easier to understand and break that up. And we used infographics. We did a lot of videos. So it was truly a multimedia, omni-channel approach. The good news and the bad news is everybody wants that stuff now for their non-COVID related.
Yeah. It's a good problem to have. So,
Right.
Well, good. Well, we are just about at time. Chase, do we have any questions that we want to?
Do. Yeah, we got one that we haven't answered yet. It says, Geisinger enjoys a great national reputation. Today's Med page today ran an article citing health literacy as a barrier to grasping COVID-19. What is or could Geisinger and other health systems do to facilitate health literacy locally and nationally?
That's a great question. I actually was just before this, I was on a call on explaining the benefits or the lack of benefits of antibody testing and to patients. And with all due respect to my clinical colleagues, I had to tell them that we really needed to write this at a 6th or 7th grade reading level. And the vocabulary was just way too clinical and technical. And so I think it's just being very mindful of the recipient, the reader. And, we talk a lot about personas in marketing and communications, and really thinking about the end user and not getting overly influenced by the subject matter experts that we all work with, who we respect and need them to make sure that we're accurate. But we have to be the translators. I also think the omni-channel piece that we talked about earlier is important. You can't assume that the written word is the only way to communicate something. How do you do it in graphics? How do you do it in a video? Should you be doing some sort of live event and walk people through a question and answer session? Those are all, I think, more opportunities for us to improve health literacy.
Yeah, and the multicultural piece, so important too, of not just the, I'm sure we all have heard the phrase of it's not just translating, but it's transcreating, because some of the things that you do, that they just don't make sense in some markets. So I don't know if anybody saw what was put out in Ventura County, which is just down the street for me here in Santa Barbara. But they tried to put out a social distancing, and maybe Chase, I'm going to put you on the spot. Maybe we'll have to put it up on tomorrow's or something. but it's just like totally culturally insensitive to how they put forth the information, and there was a huge backlash against it. And so when we're thinking about getting information out, it has to be in the context of people and their cultures, and it's not just language, it's culture too. So
Absolutely.
Well, we are at time. Don, so good to have you. So good to talk to you. Always great to hear what's happening at Geisinger, and you're always on the leading edge of what's happening across the country, and we appreciate you taking the time. I know there's so much happening, so but great to see. Great to see you and have you on. And with that, we will wrap up. Chase, thanks for your help as always. Chris Bevelo will be back in the hosting seat tomorrow. He's actually going to be talking about all that we've learned from these podcasts over the last few months and what we can expect, because tomorrow will be our last daily podcast. We're going to be making a transition there. Visit our website, thinkrevivehealth.com/COVID-19 for today's recording and some relevant content. And to just all of you out there, healthcare marketers and communicators, keep up the good work, playing a really important role, the things that we've talked about today, and making sure we're keeping people safe, helping your organizations safely get patients back into the care that they need. So with that, we will see you tomorrow. Thanks for joining, and have a great day.